Welcome on behalf of Dr. Agarwal Eye Hospital, all of you, for joining us for this webinar. This webinar is today to talk about managing the silent thief of sight, that is glaucoma. We have with us our glaucoma specialist, Dr. Anin Sethi, with us. Brief about Dr. Anin Sethi. Dr. Anin Sethi has completed his MD Ophthalmology from prestigious All Indian Institute of Medical Sciences, AIMS, New Delhi. He completed his senior residency from the same institution in the field of glaucoma. He has expertise for various simple and complex surgical procedures in glaucoma and is currently working as glaucoma senior consultant at Mircha Laser Eye Clinic, a unit of Dr. Agarwal Eye Hospitals. He has nearly more than 10 years of experience in the field of glaucoma and has performed more than 3,000 surgical and laser procedures for the glaucoma. I would welcome now Dr. Anin Sethi to join us and give us good insights about the glaucoma, how we can prevent it, what are the symptoms, and what we need to do. Welcome, Dr. Anin Sethi.
Thank you, ma'am. Thank you for the kind introduction. So, a very good afternoon to everyone who has joined us for this webinar, Managing the Silent Thief of Sight, Glaucoma. I would try my best to educate our audiences about this disease. So, in this webinar, we'll discuss what is glaucoma, types of glaucoma, causes and risk factors of glaucoma, symptoms, diagnosis and screening, and some treatment options as well. And at the end, we'll have a Q&A session as well. So glaucoma is the third leading cause of blindness in India. And the burden of glaucoma patients is approximately 1.2 crores. And glaucoma contributes to almost 13% of blindness in India. It is important to note that unlike cataract and refractive errors, glaucoma causes irreversible blindness, and it needs to be caught at an early stage to really benefit the patient. So what is glaucoma? Glaucoma is a group of eye diseases which causes the degeneration of the optic nerve. Now, the optic nerve is a nerve which connects the eye to the brain. It transmits the signal from the eye to the brain, and it has a major role in the eyesight. So in glaucoma, this degeneration of the optic nerve takes place because of the rise in pressure of the eye. So there is pressure inside the eye. This pressure is because of a fluid which circulates inside the eye. And this fluid is responsible for maintaining the shape of the eye and also the nutrition of the eye. But in glaucoma, the pressure of this fluid rises, and this damages the optic nerve. So here is a brief video which shows us shows us this fluid and its circulation. So there is a specific part of the eye where this fluid is produced. Just a second, sorry. So there is a specific part of the eye in where this fluid is produced. This is known as the ciliary process. This fluid is secreted in the eye, and this then circulates inside the eye and reaches the front part of the eye. So this fluid is known as aqueous humor, and here it is getting drained in the angle of the eye. This drainage area is like a sieve, and it is known as the trabecular meshwork. So as you can see, the fluid is being produced here and it is draining into the angle of the eye. So usually there is a balance which is maintained in the secretion of this fluid and drainage, and this maintains a certain pressure inside the eye. But in cases of glaucoma, the drainage is not adequate, and thus it leads to increase in the pressure of fluid inside the eye. So what are the types of glaucoma? So there are four major types to classify it loosely. There is the open angle glaucoma, there is angle closure glaucoma, congenital glaucoma, and secondary glaucoma. So the open angle glaucoma is the most common type of the glaucoma worldwide. And as I mentioned earlier, that the fluid is being drained into the angle of the eye. So this drainage area known as trabecular meshwork, it has certain holes or pores through which the fluid is drained. So in open angle glaucoma, the size or the number of these pores starts reducing, and the drainage also starts reducing. So the drainage is inadequate, and again, this leads to accumulation of fluid inside the eye. So usually there is no specific cause of this blockage of drainage, and this is usually seen after the age of 40. The patient does not have any symptoms. The pressure inside the eye is not very high to cause any pain or any other symptom. There is gradual damage of the optic nerve, and by the time the patient realizes that he is having some problem, it is already too late. The second type of glaucoma is the angle closure glaucoma or narrow angle glaucoma. In this, there is a colored part of the eye. Everybody has seen there is some eyes are brown, some eyes are blue. This colored part is known as the iris. So in some eyes, which are usually smaller in size, this colored part directly blocks the drainage area of the eye. So this can lead to sudden rise in pressure in some patients. The pressure can, which is normally 20, less than 20, it can go up to 60, 70 also. And this sudden rise in pressure will cause pain in the eye, it will cause blurring of vision, and the patient may see colored rings around lights, and the patient may also have nausea. But this is only seen in 10% of these patients. Most of the patients will again have gradual damage to the optic nerve and a moderate rise in pressure up to 30. And but if the pressure rises suddenly, then it becomes a medical emergency. These patients are very common in Indian population, and this disease needs to be diagnosed early to prevent irreversible damage. So the third type of glaucoma is congenital glaucoma. It is a rare form of glaucoma, and it presents at birth or develops shortly after birth. In this, the parents notice that the eye of the child is very large in size. The black part of the cornea is looking cloudy, and the child is not able to open the eye inside in bright light. That is, the child has sensitivity to light, and there is excessive watering. In these cases, early diagnosis and treatment is very important because the child may go blind if this problem is ignored. Coming to the last type of glaucoma, that is secondary glaucoma. It is a large group of glaucomas in which there is a external cause or there is an underlying condition which is causing the rise in pressure. Commonly, we see secondary glaucoma after injury to the eye or after surgery, after inflammation in the eye, that is inflammation known as uveitis. Or if the patient is using steroid medicines, this can also increase the pressure inside the eye. So some people use steroid creams for skin conditions. If they are steroid responder, their pressure inside the eye can rise. Even those patients who use steroid inhalers for asthma treatment, they should also get their eye pressure checked regularly. So what are the risk factors for glaucoma? Age is a risk factor. Usually, primary glaucomas would develop after the age of 40 years. And if the patient has family history, any blood relation is suffering from glaucoma, then there is higher risk of developing glaucoma in such patients. Certain medical conditions like uncontrolled diabetes can lead to rise in pressure. A thin cornea, that is the black part of the eye that we see. Some patients have a thin cornea. Obviously, they don't notice it only on examination. It is seen that the cornea is thin, and these patients are also at a higher risk of developing glaucoma. And unregulated use of steroid medications, high myopia, that is a minus number of glasses, also predisposes to glaucoma in some cases. And at the end of it, intraocular pressure or the eye pressure is the only risk factor that we can control to control the progression of glaucoma. Because we cannot change the age, we cannot completely cure diabetes and other risk factors. Intraocular pressure is the only modifiable risk factor. So, what are the symptoms of glaucoma? What does the patient feel? So, in most cases, there are no symptoms. Like I said, in primary and open angle glaucoma, the pressure is not very high. The patient will not have any symptom, no headache, no blurring of vision, nothing. But the optic nerve will keep on degenerating. So, it is seen that almost half the fibers inside the optic nerve are extra. So, after 50% of damage is done, then only the patient will start having any symptoms. And if at that stage, even if we start treatment, it is difficult to control glaucoma. So that is why screening becomes very important. Only in rare cases, patients will have very high intraocular pressure, and those patients will see this kind of a picture when they uh, see a point source of light, they will see rings around the light. So some patients would notice it and come to the doctor. Rarely the patients will have pain, redness, and sometimes nausea and vomiting also if the pressure is very high. So the symptoms are noted at a very late stage, and thus screening becomes very important. So coming to the diagnosis and screening, uh, a comprehensive eye examination is very important, specifically after the age of 40 years, because it is at this age most of the eye diseases, age-related eye diseases will come into the picture. So your eye specialist will check your eye pressure, known as tonometry. The pressure needs to be less than 20 at least, and in Indian population, we do see a normal pressure of up to 18 millimeters of mercury. And second thing is optic nerve evaluation. Optic nerve is the nerve which is affected in glaucoma, and your ophthalmologist will check your optic nerve clinically, and he may prescribe scans to check the optic nerve in detail. Third test is the perimetry or visual field testing. Visual field is what we see when we look straight, the amount of area that we see. So, in this visual field, we are seeing that the upper part of the visual field is affected with glaucoma. And as glaucoma progresses, the first one, the picture A, is the normal visual field. And the patient starts developing some darkness here that indicates a visual field defect. This keeps on increasing till the patient is having tunnel vision. That is what we see in the last picture. Then the fourth test is gonioscopy. This is to classify whether the glaucoma is open angle or angle closure glaucoma. And then we can also check the corneal thickness. So just to give a loose idea of what happens in glaucoma. So this is a normal optic nerve. The rim of the optic nerve carries the nerve fibers, which relay the signal to the brain, and the central part is the cup. So in glaucoma, these nerve fibers in the optic nerve start degenerating, and the empty space, that is the cup, starts increasing in size. So this optic nerve is normal, and the visual field is normal. So as the optic nerve fibers degenerate, the cup size starts increasing and the rim size starts decreasing. So here the upper part of the optic nerve is becoming degenerated, and thus the patient starts having a visual field defect in the lower part of the visual field. And as this disease progresses further, the optic nerve is further degenerated, and there is almost tunnel vision. So what are the treatment options that we have? So the most common type of treatment that we receive, which we give to our patients, is medical management. Most of the patients, almost 90%, will be able to control glaucoma just by use of medicines. Most of these medicines are in the form of eye drop. Only in severe cases, we need to give oral medicines as well. The only caveat is that the medicines need to be used regularly. Even if one dose is missed, the pressure will rise. And it's just like blood pressure medications that you need to take them every day. It's not like an antibiotic that I take a course of 5 days and my problem will be okay, because glaucoma is a chronic disease and it will stay there. And we can only manage it by controlling the pressure, and that needs to be tackled on a day-to-day basis. So the other problem with medical management is the expenses, because these drops are usually expensive. And if the patient is using 2 to 3 eye drops every day, the patient will end up spending around 1,500 to 2,000 rupees every month on these medicines, and it is not feasible for everyone. And the third problem with these medicines is that all these medicines need to be used for a long period of time, sometimes even for 20 to 30 years of the patient's life after diagnosis. So all these medicines will have some side effects either on the body or on your eyes. So most of the medicines will cause some irritation in the eyes, will cause some allergies in the long run. So, if the patients become intolerant to glaucoma medications, they can opt for other treatment options. So, there are laser therapies. First one, which is most commonly done, is a YAG laser, peripheral iridotomy. In this, we create a hole in the colored part of the eye, that is the iris. So, if we remember from our last slide, the previous slide, the angle closure glaucoma. Uh, in the angle closure glaucoma, it is the iris which is blocking the drainage. So we make a hole in the iris so that this blockage is relieved. So this is the most important preventive treatment for angle closure glaucoma. If the glaucoma is diagnosed at an early stage, just doing this laser will uh, decrease the risk of progression of glaucoma by almost 95%. And most of these patients, if the laser is done early, will not need any medications to control their glaucoma. The second type of laser that we have is known as a SLT, or selective laser trabeculoplasty. This is indicated in patients of open angle glaucoma, particularly at an early stage. In this, a laser is used to uh, laser pulses are fired on the drainage area. This induces a biochemical reaction in the drainage area, and this increases the pore size, basically increases the permeability of the drainage area. And it has a potential to reduce the pressure by 20 to 25%. And with that, the patient may or may not may need to use drugs, but we may be able to avoid using many drugs. We can bring the number of drugs by 2 to 3, or maybe even a single drug, but it decreases the burden of medicines, basically. Coming to the surgical management, the latest in the surgical management is the minimally invasive glaucoma surgery. So these are small implants and procedures which reduce pressure by enhancing the natural drainage pathways of the eye. So these are indicated in mild to moderate glaucoma, and the MIGS, or MIGS implants available in India are iStent, and Kahook dual blade is also available. These are coming into practice. They are becoming common, and because these procedures are very short procedure, every procedure will take around 5 to 10 minutes. These can be combined with the cataract surgery, and these may decrease or eliminate the need of medicines. But this is only indicated in mild to moderate glaucoma, and these can be combined with cataract surgery, as I said. And there is a very small risk of complications, unlike other surgical treatments that we have. So, coming to the conventional surgical management, the most commonly done procedure is a trabeculectomy. It is a surgical procedure in which a new drainage channel is created in the eye to allow aqueous humor or the fluid drainage, thus reducing the pressure. It is recommended only for uncontrolled disease. and it is slightly more risky as compared to the minimally invasive glaucoma surgery that I just discussed. And the initial period after the surgery, the patient has to be very careful, and he may need to be checked regularly by his surgeon as well. So it is the oldest and most effective technique for most cases, but in some cases, trabeculectomy may not be very successful. These are the cases in which either the glaucomas which develop due to diabetes, uncontrolled diabetes, or in patients which have had a previous retina surgery done in the eyes. So in those patients, trabeculectomy may not work, and in these patients, a glaucoma valve is used. It is a surgical procedure in which a drainage implant is placed inside the eye. It is indicated again for advanced cases only. So, what modifications can we bring in our lifestyle? So, take a balanced diet rich in antioxidants, including fruits, berries, and nuts. A light to moderate exercise is encouraged. Uh, Control your diabetes and hypertension. It has been seen that meditation with the also known as mindfulness and stress reduction can help to some extent. Avoid alcohol consumption and smoking. Avoid very heavy and vigorous exercises, especially in advanced glaucoma, as heavy exercise can increase the pressure. In normal people, after heavy exercise, the pressure may increase for 10 to 15 minutes. But in patients with advanced glaucoma, as the drainage system of the eye is compromised, this pressure can remain high for up to 3 to 4 hours. Avoid exercises where the head goes below the level of the heart. That is any exercise which involves prolonged bending, specifically in yoga practices. When the head goes below the level of the heart, all the blood rushes to the upper part of the body, including the face and the head, and this exerts pressure on the eye, and certainly the pressure inside the eye can also rise. Avoid exercises which require holding of the breath, also known as the Valsalva maneuver. Like in weightlifting, when you're lifting very heavy weights, you need to stabilize your body by holding the breath and pushing, and this can again rush the blood to the upper part of the body, and this increases the pressure inside the eye. Similarly, with many yoga practices, you need to hold your breath in Anulom Vilom or Kapal Bhati and all those kind of asanas. They may be useful for normal population, but if you have advanced glaucoma, your pressure can rise and stay high for 3 to 4 hours. Another thing is that people have a compulsive habit of drinking water. They would count glasses, six glasses, 8 glasses, 10 glasses, and without feeling thirsty, they will start drinking water. So this drinking may be harmful in patients with advanced glaucoma because all of this water enters the body and increases the production of the fluid inside the eye, and in some cases it can lead to increase in pressure. So we need to be careful about that as well. Use your medicines as prescribed by your ophthalmologist. And if you are unable to use the medicines, or you are having side effects, or it is not feasible, then you can consider surgical options after discussing with your ophthalmologist. So glaucoma is a sight-threatening disease. Living with glaucoma can be a struggle. Early diagnosis is the key to maintain a good quality of life. Newer modalities like MIGS and laser therapies may decrease the burden of medicines and associated adverse effects. Consult your glaucoma specialists about that. To summarize, glaucoma can cause irreversible loss of vision and visual field. Screening is a must after the age of 40 years. Screening may be done at a younger age if there is family history of glaucoma. If diagnosed, timely monitoring of pressure and optic nerve health is mandatory at least twice a year. Newer modalities aim to provide a medication free lifestyle with minimum risk. Thank you. Also, to mark the occasion of the Glaucoma Awareness Week, uh, we at Mircha's Laser Eye Clinic are offering free glaucoma consultation and 50% off on glaucoma investigations as well. Also, Dr. Agarwal's Eye Hospitals is organizing a glaucoma patient summit on 29th of March in at the ITC Grand, Chennai. All the members of the audience who are interested can register for that as well. So now let's proceed with the Q&A session.
I would request if anybody has any questions, kindly drop that question in the chat box. We'll be taking all those questions and we'll be answering all those questions. So just to begin with, so one of the questions which has come to us is that I am diabetic and how is this glaucoma gonna affect me in the long term?
Okay. So diabetes and glaucoma are linked in the sense that there are certain kind of glaucoma which would develop and uncontrolled diabetes. In these patients, they have proliferative diabetic retinopathy. That is the last stage of diabetic retinopathy. And basically, it is the effect of uncontrolled sugar on the retina of the eye. So in these patients, the retina of the eye starts developing new blood vessels, and these blood vessels block the drainage system of the eye, and the pressure rises. And in these glaucomas are very tough to control. There is a high risk of surgical failure, medical treatment. They are usually not responsive sometimes, and they do need surgical intervention. But the only thing that we need to know is that we should keep our diabetes under control so that our diabetic retinopathy does not reach that stage, which will lead to end stage glaucoma, like we see in diabetes. And the this is a specific type of glaucoma which is seen in diabetes, but also other diabetics are also at a higher risk of developing open angle glaucomas, which are not related to diabetic retinopathy. And so these patients will should get their eyes screened for glaucoma. Yes.
Thank you, sir. Thanks a lot for this nice response. It was really a very detailed and very insightful response. Another question which has come to our
Thank you.
chat box is there anything I can do to prevent glaucoma from progressing?
Okay. So as we discussed that progression, we can only stop the glaucoma from progressing. We can only maintain the current status. We cannot reverse it. So that is where all our guns are pointing to control the glaucoma and to maintain the current status. So to control the progression of glaucoma, the only risk factor that is in our hands is the pressure inside the eye, that is the intraocular pressure. That is the only factor that we can manage. Uh, if you have been prescribed medicines for that, please use them consistently and do not stop them by choice without consulting your doctor. And other things which we can do to control our pressure, if not with medical therapy, are laser therapies and other surgical treatments, as I discussed. Also, it is important to control your blood pressure and diabetes and avoid using alcohol and avoid smoking as well. These can also increase the progression of glaucoma. And regularly have a regular follow-up. If you are having a very severe glaucoma, you would need to follow up with your ophthalmologist every 3 months. And if you are having a milder stage of glaucoma or early glaucoma, still you need to visit your ophthalmologist at least every 6 months and get your investigations done at least once a year to document the progression, because glaucoma is a very slowly progressing disease. I mean, it will not give sudden jumps, but there will be very slow changes. So the changes are seen over 2 to 3 years sometimes. So regular investigation is very important. Yes.
Right, sir. So, sir, another question which has been asked is Mr. Sandeep has asked this question that I've had diabetes since 2012. In 2019, I came to know that I have glaucoma. In 2022, I have visited a clinic and I was advised few drops. Since then, I'm using those drops, iotim drops, daily in morning in my right eye. Should I continue this? Or should I again visit the concerned doctor?
Okay. So, so, so you've been
Since
using.
2022, patient has been taking same eye drops early
Okay,
daily
okay.
morning.
Okay. So whether to stop this medicine iotim or not would purely depend on your intraocular pressure, which needs to be checked by your ophthalmologist. Some cases of glaucoma are indeed very doubtful. Some people or ophthalmologists may not be able to point it out clearly whether you have glaucoma or not. But only thing I can say, if your pressure is above 18 without using iotin, that there is a high chance that you may develop glaucoma in the long run. But to give a decision whether you actually continue, you need to continue using iotim or not, I do need to examine your eye first, and then only I can give a clear opinion on that.
Thank you, sir. Same patient has asked another question, very interesting one. Should I stop practicing Kapalbhati and Alom Vilom?
Uh, as you are just using only iotim, so I'm assuming that your glaucoma is mild. And at this stage, it doesn't really matter if you do Kapalbhati or Anulom Vilom. It is only relevant for advanced glaucomas who need to maintain a very low pressure. And these exercises sometimes can lead to fluctuations in the pressure, which will cause damage. But if you have a mild or early glaucoma, I don't think it matters to all these things will not matter.
Thank you, sir. Another question which has come to us is even if we don't have any problem related to eye pressure, should we go for checkup? Myself is 60 years old and my daughter is a software engineer who is 25 years old.
Okay. So if you're 60 years old, I would suggest that you should go and get your eyes checked once. At least once your eye pressure should be checked. Also, there are other changes which start coming in the eye because of age. So these problems develop very slowly. So you may not be noticing any changes in quality of your vision, or you may not have any symptoms. But at your age, I would suggest get your eyes checked once. And regarding your daughter, it's optional. Say 25 years of age is, if she has any problem, she can get it checked, or otherwise she can skip it. But you do need to get it checked at the age of 60.
So another question which has come to us is how much should be eye pressure?
Okay. So there is no consensus as such, but internationally, the upper limit is said to be 21 millimeters of mercury. But in Indian population, it is seen that even at the pressure of say 18, 19, the patients do develop glaucoma. And the intraocular pressure is usually a range. Uh, 18 is, we do take 18 as the upper cutoff in Indian patients. And but there is a lot of variability. People may not develop glaucoma even at a pressure of 24, 25, but some patients may develop glaucoma at a pressure of 15, because there are so many other factors which are involved. So that needs to be the target pressure needs to be set from patient to patient.
Okay. So another question is there, sir, in our chat box. I drive regularly and I have been diagnosed with glaucoma. Should I still continue driving or should I stop?
Okay. Okay, that's a very nice question. Uh, Driving, it has basically, it can be seen with two perspectives. One is that is it are you able to drive? So in advanced, very advanced glaucomas, the patients who have tunnel vision, they find it very difficult to drive because they are not able to see vehicles on the side, and they're not able to park properly, because sometimes with advanced visual field defects, patients will have a decrease in the depth perception or the 3D vision as well. So they're not able to judge the distance sometimes, and they're not able to see the vehicles that are driving besides their car or their scooter or whatever. So it becomes difficult to drive. So, but the thing is, some patients will not find it difficult, and they'll get used to the condition they are in. But it may not be safe for other people on the road. So there are two perspectives to it. For your own safety and for other people's safety, you may avoid driving if you have a very advanced glaucoma. In early stages, it doesn't matter. In early stages, it does not affect your driving skill or anything like that. Advanced glaucoma patients with advanced glaucoma should
Mhm.
try avoiding driving as much as possible.
Done, sir, done. So, sir, another question which has come to us is, should I be worried about passing my glaucoma to my future generation?
Okay. Okay. So, uh, hereditary glaucomas, I would say around 10 to 15% of the total glaucoma population is related to family history. So, yes, there is a certain risk of passing it on to the next generation. But see, primary open angle glaucoma usually has a risk of 10 to 15% of recurring in the next generation. So yes, that risk is there, but it is nothing that would that should stop you from uh, planning your family or whatever. It's not that severe a disease. But yes, in congenital glaucoma, the kids who have glaucoma since birth, that is a very severe form of disease, and it is usually seen in families with consensual marriage, or who marry in within the family. So in those patients, those cases, up to 25% of the kids may have congenital glaucoma, and that is a very severe disease. That particular set of glaucoma does need genetic counseling for further family planning. But in usual primary open angle glaucomas, that should not be an issue. That should not come to your mind. Just for screening purposes, you do need to think that okay, you need to get your kids screened at an earlier age for glaucoma, but that should not stop you from planning your family.
Okay. So, sir, there's another question which says, I have been diagnosed with glaucoma, but how often should I visit the doctor and get my eyes examined?
Okay, so that's a very nice question, sir. So the frequency of follow-up, how often you visit your doctor would depend on what stage of glaucoma you have. So in early glaucomas, follow-up to get your pressure checked every 6 months is fine, is adequate. And getting your investigations repeated every 1 to 1.5 years is okay. But in advanced cases, very advanced cases, you may need a 2 monthly follow-up to monitor your intraocular pressure and the visual field and optic nerve testing at maybe every 6 months. So that is the ideal frequency of follow-up.
Okay. So, sir, there's another interesting question which has come to us, which says that whenever I do some physical activity, again, is it gonna help my glaucoma decrease, or is it gonna increase the glaucoma?
Mm. So as I
So
said
he goes
earlier that
regularly to gym, so he is
okay,
asking
okay.
that
Ah,
should I
yeah.
be.
Yes, yes, no problem. So, if you've been diagnosed with glaucoma, again, depends on the stage of glaucoma. Early glaucomas or maybe moderate glaucomas, it does not matter that what kind of exercise you're doing, how vigorously are you exercising. But in case of advanced glaucomas, uh, it does matter. And weight training, as I said, sometimes you are lifting very heavy weights and you need to hold your breath to push the weight. So at that time, at momentarily at that time, the pressure rises and it may remain high for 2 to 3 hours in patients with advanced glaucoma. In early or moderate glaucomas, it doesn't matter. You can exercise whatever way you want.
Thank you, sir. So another question which has come to us is, are there any financial schemes available to help cover my treatment expenses, and how much is the treatment expenses of a glaucoma?
So as far as the expenses go, the medical management, as I said, if you need to use 2 to 3 medicines on a regular basis, so your expenses would be somewhere between 1,500 to 2,000 rupees per month. And if we are considering any laser therapies would cost you from anywhere some between 2,000 to 10,000 rupees per eye. And surgical management, that is then totally, that is a wide variety, and the range is anywhere from say 20 to 30,000 to 1 lakh, or it can go beyond that also. But as far as medicines are concerned, 1,500 to 2,000 rupees, that is at the upper limit that I'm telling you. And I'm not aware of any schemes that would help. Only probably your ophthalmologist can help. If they have free samples, they can give you. That's all. That's the only scheme I know. But I'm not aware of any. But yeah, some pharma companies do have these offers that they have on inside their medicine packet. They have a number you can call, and then they'll give you some free medicines. After for every 4 vials, they may give you 1 vial for free. That those options are there, but nothing, no national program that I know of that would provide glaucoma treatment expenses as such.
Right, sir. So we have another question which says that I have been using glaucoma medications, and I have glaucoma since I was 40 years old, but I'm worried that am I at risk of developing other eye conditions as well?
Okay, so and that's a very nice question. Uh, Not really. Glaucoma, if you have any of the primary glaucomas that develop on their own, not because of any other cause, then it will not affect your eye in any other way. Just the pressure will affect the optic nerve and your visual field starts decreasing, but that's the picture of glaucoma only. But yes, if you have secondary glaucomas, like glaucomas related to diabetes or related to trauma to the eye, then it changes a lot of things, because trauma can damage a lot of structures inside the eye. It can affect the retina, the lens. Then obviously other structures will be involved. And similarly for diabetes, the diabetes will affect your retina as well as it will cause glaucoma. So, and it can cause increased chances of getting cataract as well. So, secondary glaucomas will have this issue that other parts of the eye may be affected. But in primary glaucomas, in that the ones we see in adults, other structures of the eye are usually not affected.
Okay.
Yes.
So sir, there's another question which has come to us in Hindi. पिछले 11 वर्षों से मुझे दिन में 2 बार कॉम्बीजैन ड्रॉप्स दी जाती हैं। क्या ग्लूकोमा का इलाज संभव है?
जी देखिए, कॉम्बिगैन ड्रॉप 2 बार जैसे आप डाल रहे हैं, जैसे मैंने बताया, ग्लोकोमा को ज्यादातर ग्लोकोमा को जड़ से मिटाना अभी तक पॉसिबल नहीं है। जिन पेशेंट्स का आंखों का प्रेशर बढ़ता है, उनमें दवा डाल के ही उसको कंट्रोल किया जाता है। अगर दवा नहीं डाल पाते हैं तो फिर उन्हें ऑपरेशन का ऑप्शन दिया जाता है। बट जो नुकसान आंख में हो गया है, वो वापस नहीं होता। जो आंख की नस कमजोर हो गई है, उसको दोबारा से ठीक नहीं किया जा सकता, पहले जैसा नहीं बनाया जा सकता। हम केवल इस बीमारी को कंट्रोल कर सकते हैं। हम इस जो भी डैमेज हो रहा है या नुकसान हो रहा है आंख की नस का, उसको वहां पर उसी लेवल पर रोक सकते हैं। पर उसको रोके रखने के लिए आंखों का प्रेशर कंट्रोल करना पड़ता है, और प्रेशर कंट्रोल करने के लिए डेली बेसिस पे दवा डालनी पड़ती है। कोई ऐसी दवा नहीं है कि हम कुछ महीने डाल के छोड़ेंगे और फिर ठीक रहेगा। तो इसलिए आपको कॉम्बिगैन दी गई है, तो अभी तो आपको कॉम्बिगैन डालनी पड़ेगी। बट अगर उससे कोई तकलीफ हो रही है तो वो फिर आपको अपने आई डॉक्टर से कंसल्ट करना पड़ेगा।
So, sir, another question we have is what should I do if I experience side effects or complications from glaucoma treatment?
Okay. So, glaucoma treatment, I'm assuming that if you're talking about medical treatment, that is eye drops. So, yes, that is a very common problem. More than 50% of patients would sometimes stop putting their medicine just because of these side effects. So, if you are not able to use your medicines, or you're having problem with your eye drops, you can always consult your glaucoma specialist to give you other options. So there is the option of laser treatment. It may reduce the number of medicines that you're using, and there are newer treatment options in the market, which again are can be tried if you have mild to moderate glaucoma, and it may reduce the number of medicines that you need. And at the end, if somebody is really totally allergic to medicines and the pressures are very high, so then we can go ahead with uh, uh, advanced surgeries like trabeculectomy or glaucoma valves as well.
Okay. So it has been really nice session, sir. You have answered all the questions very in details, and I think so. Most of the people would have understand glaucoma, how it progresses, what is the frequency of doctor visit, what kind of medication to be used, what all are the side effects, and all these things. Now, I would request we will be
Thank you,
closing
ma'am.
this session here, and if any patient, anybody has any questions, please kindly contact us as at patientcare@dragarwal.com, or you can also call us at the number which is showing at the screen. We are also having free glaucoma consultation for patients for this month from 1st of the March till 24th of the March. And also we are offering 50% off on the glaucoma workup for the investigations. So it was really insightful session, sir.
Mm.
Thank you.
Thank you, ma'am.
And
Thank you.
here we'll close the session, and we'll take all the questions on the email now.
Okay. Thank you,
Thank you.
ma'am. Thank you for the opportunity.
Thank you all.